If you are a man over 60 and you have noticed that something feels different down there, slower to respond, less intense, harder to finish, I want you to hear this clearly before you assume it's simply age catching up with you. It probably isn't. In my years treating senior patients, I have sat across from dozens of men who were convinced their bodies were simply shutting down, quietly, permanently. And in almost every one of those conversations, the real culprit wasn't age at all. It was 3 everyday habits these men had carried since their 20s, that their bodies could no longer tolerate the same way. Here's the part that catches people off guard. These aren't bad habits. They're not reckless or unusual. They're ordinary patterns that worked perfectly fine for 40 years and then stopped working, almost overnight, somewhere past 60. Nobody warns you about this transition because almost nobody talks about it at all. By the end of this video, you'll know exactly what those 3 habits are, why your body suddenly reacts to them so differently, and, more importantly, the precise adjustments that can bring real function and sensation back, often within weeks. One of these 3 will genuinely surprise you because it's something almost nobody considers a health issue at all. I'm Dr. Rachel Augustine, and for years I've focused specifically on helping seniors understand what's actually happening inside their bodies, without the medical jargon and without the shame that usually surrounds these conversations. If you've ever wished a doctor would just sit down and explain this plainly, that's exactly what today is for. Stay with me to the end, because the 3rd habit is the one that catches even health-conscious men completely off guard. Let's start with something I want every viewer to really absorb. A changing sex life after 60 is not a story about decline. It's a story about your body asking for a different set of instructions. Here's what's physiologically true. Starting around age 50, testosterone begins a slow, steady decline, roughly 1 to 2% per year. On its own, that number looks harmless. Stretched across a decade, though, it adds up to a meaningfully different hormonal environment. The usable form of testosterone, the kind your tissue actually responds to, drops even faster than total testosterone does. Long-running studies tracking thousands of aging men have confirmed this pattern consistently over nearly 20 years of follow-up. Alongside that hormonal shift, nerve sensitivity in genital tissue naturally decreases, blood flow patterns change, and the body's recovery window after climax, what's clinically called the refractory period, stretches out considerably. Arousal may need more direct stimulation to build. Firmness may take more conscious effort to sustain. None of this means anything is broken. It means the operating instructions your body wrote for itself decades ago are now outdated. You're running a 1985 manual on 2026 hardware, and that mismatch, not age itself, is where most of the trouble actually begins. So let's walk through the 3 habits, one at a time. Habit number 1, the pressure problem. Most men settle into a personal technique early in life and never consciously revisit it. There's no reason to. It worked, reliably, for decades. But here's the quiet physiological shift that happens with age. As natural sensitivity declines, the instinctive reaction is to compensate with more pressure, more friction, more intensity. It feels like the obvious fix. Physiologically, it's the opposite of helpful. Clinicians use a specific term for what develops from this pattern over years, a conditioned response built around excessive force, far beyond what any partnered touch could realistically replicate. Peer-reviewed urology research has linked this pattern directly to difficulty achieving erections, delayed climax, and in more severe cases, an inability to reach orgasm at all. The mechanism is straightforward once you understand it. Every session built around extreme intensity teaches your nervous system that this level of stimulation is the minimum threshold required for release. Over time, anything gentler simply stops registering as meaningful arousal. The nerve pathways essentially recalibrate themselves around intensity rather than sensation. This shows up in 2 frustrating ways. First, solo climax starts taking longer and requiring more effort than it used to. Second, and this is the one that troubles men far more, intimacy with a partner starts feeling underwhelming, not because anything is wrong with the partner, but because nothing a human touch can provide matches the specific pressure the nervous system has been trained to expect. One peer-reviewed study published in 2023 found that men using high-pressure or face-down stimulation techniques carried more than double the risk of erectile difficulty compared to men who didn't. Now here's the encouraging part. This is not permanent damage. It's a learned pattern, and learned patterns can be unlearned. With consistent change, most men notice a real difference within 4 to 6 weeks. Full recalibration can take a couple of months, but it does happen. The fix is simple in concept: lighter pressure, a slower pace, the addition of lubrication to reduce unnecessary friction, and patience while your body resets its baseline. This isn't about giving anything up. It's about regaining sensation you've actually lost without realizing it. Before we move to habit number 2, I want to ask you something honestly. Has any doctor ever sat you down and explained how this part of your health changes after 60? Drop a yes or no in the comments. I read every one, and I promise you, the silence around this topic is far more common than you'd expect. And if you want more of these honest, clinically grounded conversations without the awkwardness or the shame, hit subscribe right now and turn on notifications. I publish new senior health breakdowns every week, and trust me, habit number 3 coming up is the one almost nobody sees coming. Habit number 2, the frequency trap. You've probably heard some version of use it or lose it when it comes to sexual health later in life. It gets repeated so often that it's become a kind of blanket permission slip. Keep going, don't slow down, anything is better than nothing. That advice isn't wrong exactly. A major Harvard-affiliated study following nearly 30,000 men over more than a decade found that more frequent ejaculation was associated with a meaningfully lower risk of prostate cancer. Regular sexual activity also helps maintain healthy blood flow to genital tissue, which supports function over the long run. There are genuine, well-documented reasons to stay sexually active as you age. But here's the part of that advice nobody finishes. Frequency without awareness isn't the same thing as healthy frequency. After 60, your body's recovery window lengthens substantially. For a man in his 20s, that window might be measured in minutes. For a man in his 60s or 70s, it can stretch to a full day or longer, depending on cardiovascular health, hormone levels, and overall fitness. When activity happens faster than the body can genuinely recover, the hormonal and neurological systems never get the chance to fully reset, which produces a duller, less satisfying experience. Many men misread that dullness as further proof that they're losing it, which sometimes pushes them toward even more frequent activity in an attempt to compensate. It becomes a cycle working directly against the outcome they want. There's also a pelvic floor component that rarely gets mentioned. These muscles, which play a direct role in erectile function and ejaculation, recover more slowly as we age. Repeated activity without adequate rest can create chronic pelvic tension, and research connects that tension to both reduced sensation and erectile difficulty. So here's the real question worth asking. Is the issue really how often you're doing this, or is it what's happening during each session? That question leads directly into the third habit, which is the one that surprises my patients the most. Habit number 3, the autopilot pattern. For most men, solo activity became routine long before they ever thought about it with any real intention. It was private, efficient, mechanical, a sequence performed the same way, aimed at the same outcome every time. In younger men, that autopilot tends to work just fine, because a young nervous system is forgiving and the hormonal environment fills in the gaps automatically. After 60, that forgiveness disappears. When the entire experience becomes purely outcome-focused, reaching climax as quickly as possible, often paired with intense visual stimulation, something happens quietly in the background. The brain's arousal pathways begin associating sexual response with one very specific, very high-intensity input. Natural arousal, built on subtler cues, imagination, and a slower buildup of genuine desire, starts to feel insufficient by comparison. This is sometimes referred to clinically as stimulus-conditioned arousal. It isn't unique to older men, but it hits much harder after 60, because the hormonal and neurological reserves that used to smooth over these gaps are no longer as abundant. I see the emotional fallout of this regularly. A man who functions perfectly well with a partner suddenly finds himself struggling with no clear medical explanation. He doesn't connect it to his private habits, he connects it to age, and the story he starts telling himself that this part of life is simply ending creates a second problem entirely on its own: performance anxiety. The fear of failure activates the body's stress response, which directly works against the ability to perform, meaning the fear often manufactures the very outcome the man dreads. The solution isn't to stop the activity altogether. The solution is to change the relationship with it, slowing the pace, removing the pressure to finish, allowing sensation to lead rather than chasing a result. Sex therapists have a name for this recalibration approach, and it's backed by a solid body of evidence. Many specialists recommend it specifically for men navigating exactly this pattern. When the activity becomes something experienced mindfully rather than executed mechanically, the entire physiological response shifts along with it. I want to say something plainly here, because it deserves to be said without mincing words. Staying sexually active past 60 is not something to apologize for or hide. The research backs this up clearly. Regular activity supports prostate health. It helps maintain healthy blood flow to genital tissue. Climax releases oxytocin, lowers cortisol, and has measurable documented benefits for mood and cardiovascular health. Your sexual health is simply part of your overall health. Full stop. What connects all three habits we've covered today is this: none of them are signs of weakness or failure. They're simply techniques built for a younger body that were never updated for the one you have now. So what does an updated approach actually look like in practice? A lighter touch, paired with lubrication, at a pace that lets sensation build naturally instead of forcing it. Respecting your body's recovery window instead of pushing past it. Staying present in the experience instead of outsourcing arousal entirely to external stimulation, and letting go of the expectation that your body must perform exactly the way it did 40 years ago in order to count as working. Some men find real value in a short, intentional pause, 1 to 2 weeks, not as a punishment, but as a deliberate reset that allows sensitivity to recalibrate. Most who try this report noticeably improved sensation and reliability when they return to activity with a more mindful approach. That said, if you're noticing persistent erectile difficulty, a significant drop in sensation, ongoing discomfort, or a complete absence of morning erections, those are signals worth bringing to a real clinical conversation. Low testosterone, vascular issues, diabetes, and certain medications can all play a role, and every one of them is addressable once properly identified. You do not have to simply accept decline as inevitable when there may be a clear explanation and a clear path forward. Your body hasn't given up on this part of your life. More often than not, it's simply waiting for the right conditions. If this video gave you something genuinely useful, I want to ask 2 things of you. First, send it to a man in your life who needs to hear this, because the silence around this topic costs people more than most realize. Second, if you haven't already, subscribe to this channel right now. Every week, I break down exactly what's happening inside an aging body, clearly, honestly, and without the embarrassment that usually surrounds these conversations. Next week, I'm covering a topic that sits right alongside this one, something I get asked about constantly. You will not want to miss it. I'm Dr. Rachel Augustine. I'll see you in the next one.